Thank you for the opportunity to talk to you today about why we feel there's a need for a commissioner on ageing and older persons in Ireland. But firstly, Age Action, what we do and who we are is on the screen, and also, I just wanted to mention as well that we're accredited to the United Nations Open-Ended Working Group on Ageing, which is the body there that Susan was talking about that's seeking a convention on the rights of older persons. We're also a member of the National Safeguarding Authority Advisory Committee, which Patricia will talk about. And we're also a member of the Department of Foreign Affairs Human Rights Committee. And all of this is in an effort to get a convention on the rights of older persons at the international level, but also to seek changes, positive changes in legislation and in attitudes to ageing domestically here in Ireland as well. And our information service is open 5 days a week, and weekly we deal with calls about elder abuse or alleged elder abuse. I take some of the calls myself, we all do, because it's really important that we understand what's happening on the front line and to understand how that manifests itself in people's lives, not just at an institutional level, but also at a domestic level and a household level, as we've talked about a lot today, which is where human rights are. So the first question I'm always asked about when we talk about a commissioner, what does it do? Well, it can do lots of things, but what we would like it to do is by establishing a commissioner for ageing and older persons with a supporting legal framework and an independent budget would ensure that we are all treated with dignity and rights on the same basis as the rest of the population. And the Declaration of Human Rights says that all human beings are born free and equal in dignity and rights, and dignity comes first. And it is really important that we respect people's dignity as well as their rights. A commissioner would provide an opportunity to improve the efficiency and effectiveness of society's approach to an ageing population by bringing an appropriate level of insight, representation and transparency to policy on ageing. A commissioner would provide an independent voice to government on the needs of current and future older people and promote cohesive, efficient, best practice government policy and services for the growing number of older persons. For example, one action for the Commissioner would be to participate in the necessary independent investigation into the negative experiences of many people who lived and died in nursing homes during COVID-19. To date, more than a third of deaths from COVID-19 occurred in nursing homes, and an investigation is needed to establish the circumstances of each and every death in nursing homes and the response measures and how they did or did not support the equality and rights of all residents of nursing homes. Unlike other cohorts, such as those under 18 or people with disabilities, older people have not really until recently been explicitly recognised under international human rights law. There is recent momentum towards an international convention on the rights of older person and against age discrimination at the multilateral level, but a Commissioner for Ageing and Older Persons in Ireland, supported by that legal framework, would ensure that a mandate, guidance and support is available in Ireland to ensure that the rights of all of us as we age can be realised. As a member of the UN Security Council and an active supporter of the international human rights norms in its foreign policy, Ireland should be and could be at the forefront of championing greater international recognition of the rights of older persons. So who is a commissioner for? It's for all of us. Everyone here, hopefully, is going to get to be older and what we term older. So it is for all of us. And I think it's really, really important that we keep remembering that it's not that othering of older people that Mandy talked about at all. We're all aging. We all hope to be older. Most of Ireland's 720,000 people over the age of 65 don't have access to representative bodies or state resolution mechanisms that are available to employees or business owners. We seem to lose a lot of our rights when we retire or become retired or stop working or potentially have been reliant on the social welfare system for most of our lives, as many of us are. A commissioner would address this gap by bringing representation and transparency to issues relevant to older people. A Commissioner for Ageing and Older Persons could also support the programme for government's pledge to make Ireland an age-friendly society, not least by providing an authoritative voice for the rights and equality of older persons. So why do we need a Commissioner? There is a persistent gap in the institutions of the state which points to the need for a Commissioner for Ageing and Older Persons. A Commissioner would provide that independent voice to government on the needs and rights of older people and of everyone as we age, to promote efficient, best practice policies and to assist individuals and groups to overcome barriers to the realisation of their rights. It is time to take a step forward by establishing a Commissioner for Ageing and Older Persons to acknowledge and address those gaps associated with the current status quo. We need the independent advocacy and oversight to ensure adequate planning to maintain the rights and dignity of all of us as we age. You have to wonder if we would had a policy to cocoon people over the age of 70, had we had the benefit of a Commissioner for Ageing and Older Persons when the COVID-19 response measures, would we have had the same restrictions on visiting that we had in nursing homes? Would we still have congregated settings if we had the oversight of a Commissioner for Ageing and Older Persons? The Constitution of Ireland recognises the state's duty to safeguard the interests of people when they reach old age or if they're affected by disability. Age discrimination has been recognised in the Employment Equality Acts since 1998 and the Equality Status Acts since 2000. Yet there is a lack of an infrastructure to ensure that the rights of older people with respect to their age are respected, protected and fulfilled. For example, there's been an Ombudsman for Children since 2004 alongside a full Minister for Children and Youth Affairs since 2011, but there is no equivalent independent authority tasked with the promoting of rights and equality and welfare for older people. So why else do we need an Ombudsman or a Commissioner for Ageing and Older Persons? It's because that's what older people have told us that they want. Actually, with Active Retirement Ireland, Age Action campaigned in the last general election for a Commissioner for Ageing and Older Persons to be included in government in-party political manifestos. It is about 93% of people surveyed by Age Action agree that we should have a Commissioner on Ageing and Older Persons. And there's some in other jurisdictions as well, so the precedence is set. The existence of a Commissioner for Older People in Northern Ireland contributes to the equality and rights envisaged under the Belfast Good Friday Agreement, and the establishment of a similar office in Ireland would only strengthen our shared equality and rights agenda. The question we're always asked when we pitch this to elected officials is how much would it cost? And for us, relatively little considering the amount of people it will directly support. Currently, there are over 1 million people aged over 60 in Ireland, and that's going to increase. We estimate the cost to be in the region of €2 million based on the budgets of the similar offices in other jurisdictions. So the other question is, would it be effective? We get this a lot because would it be an ornament? Would it be a quango? Would it have any usefulness at all? Is it just a figurehead? But it is clear to us that as our populations ages, greater numbers of people will be affected by age-related discrimination or ageism. The absence of a dedicated entity or person with responsibility to safeguard and promote the interests of ageing in line with the normative human rights frameworks and standards means that nobody is tasked with ensuring that gaps in policy and inaction that disproportionately impact older people are monitored and remedied. While recent years have seen welcome moves to introduce policies such as the National Positive Ageing Strategy and the appointment of a Minister of State for Older People, it's clear that it is not sufficient to prevent the gaps in action and policy that disproportionately affect older people. For example, the National Positive Ageing Strategy has not been fully implemented, although it did establish principles to guide the policy. So the establishment of a Commissioner for Ageing and Older Persons would be a contribution to the current UN Decade of Healthy Ageing. It would also be a tangible response to the UN Global Compact against ageism. And supporting these initiatives through establishing a commissioner would send a strong signal to reaffirm Ireland's commitment to the global equality and human rights agenda at both the United Nations Security Council and the Human Rights Council.